Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the pharmacology of the adrenergic receptors, also called adrenoceptors. Adrenergic receptors are found in the sympathetic nervous system. Sympathetic nervous system for fight or flight. There are several classes of adrenoceptors. Most important are the alpha and beta, and we have the alpha 1, alpha 2, beta 1, beta 2 receptors are identified on the basis of their responses to the adrenergic agonist like epinephrine, norepinephrine, and isopoterenol. These are proteins belong to a multi-gene family. Alteration of the key structure of the receptors influences their affinity for various drugs. So the adrenergic receptors or adrenoceptors have the alpha adrenergic receptors. They are generally stimulatory except in the gastrointestinal tract. Alpha adrenergic receptors mediate vasoconstriction, gastrointestinal relaxation, mydriasis, inhibition of insulin release, and lipolysis. Beta adrenergic receptors are generally inhibitory but also exception in effects on the heart, lipolysis, and renin secretion. The receptor may be desensitized if they are exposed to prolonged contact with that of the catecholamines. They will be desensitized due to down regulation, also changes in their structure, and also changes in the G protein. Adrenergic receptors or adrenoceptor, alpha 1 receptor, these are stimulant, they have stimulant action. They cause vasoconstriction to the skin and abdominal viscera, increase total peripheral resistance, increased blood pressure, dilation of the pupil called mydriasis, the dilator pupil of the muscle. Pupil is the gap inside in the center of the iris, and the iris has muscle like the dilator pupillae muscle. So if that muscle contracts, then there will be dilation of the pupil, and that lead to mydriasis. Increased closure of the internal sphincter of the bladder, another action of the alpha 1 receptor. What are the locations of alpha 1 receptors? The receptors are present in the gland, smooth muscles, and postsynaptic membrane of the effector organ, vasculature of the skeletal muscle, and alpha 1 receptors are stimulants. We know that part. Vasculature means the blood vessel in the skeletal muscle. They have also smooth muscle in the blood vessel. So these are the locations of the alpha 1 receptors. Alpha 2 receptors, these are inhibitory action. They have inhibition of norepinephrine release. Norepinephrine is a neurotransmitter coming out of the postganglionic sympathetic fibers that also inhibits insulin release. Location of the adrenergic receptors, presynaptic nerve endings. Also, this is the most important site. Also, some of the receptors are located in the postsynaptic nerve terminals and the beta cells of the pancreas, platelets or thrombocyte, smooth muscles, and the adipocyte or fat cells. So adrenergic receptor, beta-1 receptor, these are stimulant receptors. They're adrenergic agonists. They increase the heart rate, increase lipolysis, increase myocardial contractility, increase release of renin. Location of beta-1 receptors, heart. Juxtaglomerular cells of the kidney. Location of the beta-1 receptors. Adrenergic receptors or adrenoceptors, beta-2 receptors, these are inhibitory in action, adrenergic antagonist. So what they do, vasodilation in skeletal vascular bed, slightly decreased peripheral resistance. They are bronchodilators. Okay. Receptors are related with bronchodilation. Stimulation causes bronchodilation. So that's very good for the patient with bronchial asthma. Increased muscle and liver glycogenolysis. Breakdown of glycogen to glucose. Increased release of glucagon. Glucagon is a hormone released from the alpha cells of the pancreas. Relaxation of intestinal and uterine smooth muscle. Again, this action is done by the beta receptor inhibitory action. Location of beta receptor, vasculature of the skeletal muscles, glands, and organs. Organs means viscera. Okay. So got that. Now, and that's all about the adrenoceptors or adrenal receptors, alpha-1, alpha-2, beta-1, beta-2. And these are proteins, and alteration of those may affect the action of the drug, and type of drug will work on different type of receptors. And that's all for today about the pharmacology of the adrenoceptors. If you have any question, please feel free to ask me. Please share the information with your friends. Please subscribe me. Please support my channel. Have a nice, wonderful, and blessed day. Bye now.